I'm Bernd Frauzem. I'm the husband of Monica Frauzem.
We've been married for 32 years, so quite some time.
We have 3 beautiful children, 2 granddaughters.
He's a wonderful dad. We always have been very active.
We always try to go for hikes or walks. One day, I collapsed in the office.
When he told me that he was in the ER, I really wasn't that surprised because he didn't seem right to me. I noticed changes in him. He was low energy. He started moving more like an old man.
And Monica also felt when we went for a walk that I was always steering to the right.
Straight from work, I went there to the emergency room to see what was going on there. And they really didn't do much testing. They basically just ran EKGs, and 3 hours later they just released him because, all his blood work was fine, every vitals were fine. I still was worried and I didn't like the way he was acting.
So I made an appointment with my primary care physician, and he didn't understand why they didn't do a head scan, because maybe it wasn't fainting, maybe it was actually a seizure. You never know. The primary care physician immediately said, "You're going to go to Hoag Irvine and get an MRI done." When I got the news that I had a brain tumor, it was quite intense and devastating, because I didn't know what's going to happen with my life or how long I'm going to live.
Dr. Lewis, the neurosurgeon, was pretty confident that it was a glioblastoma,
which typically has a pretty poor prognosis. Bernd had a fairly large tumor, about the size of an orange. So you can imagine how an orange-sized tumor fitting into your head and compressing your brain really has the potential to do a lot of harm. If we didn't do surgery, this tumor would continue to spread rapidly, and he wouldn't survive 6 months.
At one point, you just let go and you give yourself to the people you trust. And that's what I did.
These tumors, as they get large, they kind of grow with fingers into the brain, and that's what makes them so difficult to remove surgically. It used to be we would have the ability to look at the MRIs and they give us these cross sections, or these, two-dimensional snapshots of different slices of the brain. And that's truly where the advantage of surgical theater comes in. It creates an exact 3-dimensional replica of the patient Bernd's brain, not just the tumor, but also the critical structures, the motor pathways, the sensory pathways, the speech pathways. So what this then allows is for me as the surgeon to simulate the operation on a specific patient. And we can do it as many times as we need, because there's no cost of getting it wrong on the simulation, in the virtual reality. That way, by practicing again and again, we can make sure we get it right the first time when it really counts in the operating room. Around the border of it, you can follow the arrow. This technology is absolutely life-saving, and in my opinion, is the future of brain surgery. What we're looking at now is a 360-degree view of your brain, your skull, and the tumor. One of the great things that the surgical theater system also does is help the patients to understand the problem, as well as understand the plan for surgery to fix it. The good thing is that it's in your right temporal lobe, which is one of the safer areas for us to be able to be fairly aggressive as far as resecting the tumor. During surgery, we use the same system, the same 3-dimensional reconstructions, and take those images and combine it with the intraoperative navigation system and inject them into the eyepiece of the microscope. So like a heads-up navigation display on a car, I'm able to see the outline of the tumor during surgery while I'm operating.
With surgical theater, I knew he could do the best job without hurting me in any ways to remove 98% of my tumor.
Which, to me as a surgeon, is the greatest joy that I have.
It's amazing that he was able now to hold his second granddaughter already, and we just plan that he still will have a lot of time with us.
After 2 years, I do have my life back. I even had it back earlier than that, and I'm still planning and making sure I have goals and doing backpacking trips, going for hikes, going out every day, doing the things I like to do.
When I get updates from Bernd and he sends me pictures of him, hiking in the Alps or crossing the Grand Canyon, this is why I get out of bed every day. This is what truly makes me want to continue doing what I do and loving surgery for the ability to restore people's lives with the help of this amazing technology, surgical theater.